6:32.
No, we're going to recite it for the camera as well.
Executive session ended at 6:32, and we will resume our regular meeting this time.
And the motion to end the executive session
Was no action.
was made by Stephen Kroll and seconded by Jim Stairs, and there was no action taken
In executive session.
in the executive session.
Continuing report. Executive Director's report, Tim?
Hopefully everybody has a copy. If you look at this report, it's a little longer than my usual reports, but I'll speak to some of the important points, I think. A couple things on the front page for everybody that's present tonight. The auditors will be here next meeting, the April meeting, to discuss the annual audit and the financial report. On the first page, other important stuff there, other than we've been pretty busy making the rounds in the meetings, which is exactly what I want to do. The active shooter CME has been rescheduled. Trooper Kakis is going to be here April 11th. 3 credit hours, spread the word. We've got it out there, and you know, all our media points now, but spread the word. One other reminder, EMS award nominations. I've sent several reminders out here. They have started to trickle in. Schenectady County surprised me today and submitted about 6 of them. I've got a number of other ones there too, and they've all been forwarded to the awards chair, Brian Wood, and hopefully he disseminates them with the rest of the award committee members. The second page, maybe I was remiss in putting this in one of my past reports, but Steve asked me just to give you guys a little update. If you remember, I was tasked with developing a REMO business plan, both short-term and long-term objectives that I highlighted in that plan. And some of the stuff on that second page is stuff that we've been working on since the first of the year or so. Everything that's on here is related to stuff that I included in the plan. I spoke about expanding our presence relative to continuing education here at REMO. We're kicking that off with the active shooter, but you're going to look for a couple others coming up spring, early summer. And one we talked about with the staff that I thought was interesting is a CME relative to EMS management and human resources, because you don't find very many of those CMEs out there that discuss, either with administrators, chiefs, or just frontline providers, how to manage their human capital. So we're looking at that right now and trying to line up good speakers for that. Another thing I spoke about in the business plan was community outreach and how to expand REMO's footprint out there to people that don't know who we are or what we do. Once again, we have a table reserved at the Columbia Green Day, and that's a great way for us to reach out to people in the southern region there, and it's always met very favorably down there, and we get a lot of participation. People come up and speak to us that normally probably wouldn't make the trip up here. Narcan has greatly expanded, even over the last few months. And what we're doing now is we're reaching out to lay providers. We just held two classes, and the dozen people there, I think the vast majority, if not all of them, were lay providers. So not only are we training and retraining our EMS, basic life support EMS folks, but we're reaching out to the general public as well. We also talked with the staff, and I have a staff meeting tomorrow, and a bunch of these are agenda points from the meeting tomorrow morning, but we discussed the possibility of having some type of round table here, and you've probably heard of them or seen them or read about them in the paper, where we could have a group of people here, whether they're the quote experts or not, and they're politicians, and they're EMS providers, and they're physicians, ER physicians, and medical directors, to just hash this out and have a go-around of what else we can do to contribute to, you know, this opioid crisis. What other initiatives can unfold from this organization to help with that? So look for something like that too. We're really thinking about doing that. QI. Deb and Jen, I have to give credit to them. They've hit the ground running. They also have a meeting with Doc Daly tomorrow. I talked about resurrecting or reviving the QA or QI committee, and that's what we're trying to do. And they have a whole bunch of speaking points. They're going to sit down with Doc Daly, and I believe it's Doc Williams, Dr. McHugh, correct? The new chair of QI. Tom Williams from Albany Meds, the new QI chair. So they're meeting with them tomorrow to discuss some talking points about who does what. It's more of a meet and greet, but everybody's going to get together to get on the same page and see how we can move that process forward again. And the last thing, one of my last budgets, I talked about some type of learning management system. And we also have a webinar, the staff has a webinar tomorrow with a company called EMS One. EMS One is only one of 2 companies approved in New York State for online CME by the Department of Health. So they're going to show us a little bit of who they are and what they do, and whether, we'll think about whether that's something we want to explore. Another great option with that training tool is morphing it or hybridizing it into online EMT training. We always rack our brains how we can expand participation, gather more people in for our classes and stuff, and if we can have an online component to some of our training, I think that would be of great benefit to us. So that's basically it. That's in a nutshell what we've been working on there. And periodically I'll give you updates relative to what I spoke to you about tonight and other initiatives related to that business plan that we'll be working on towards the future. So that concludes my report, unless anybody has any questions for me. Thank you.
Bylaws review, Steve is going to review that for them.
I've got 3 things tonight. I had asked Anne Marie if I can go out of order. I have to leave in 10 minutes, unfortunately. I've got an emergency to deal with tonight. But on the bylaws, Lynn had to leave unexpectedly, but she has brought a copy of the draft, what is the final draft of the bylaws, or I believe is the final draft. I was going to make a suggestion, but I understand some members of the bylaws committee may want to say something about that. We reached a lot of compromises as a group during our working session at the last meeting, and Lynn was tasked with working with the committee in putting it together and bringing it back here. And so Lynn has brought it back here. I was going to suggest that we distribute it to everybody tonight, that we ask them to take it home and read it and come back next month ready to vote on them. And I was even going to suggest that someone make a motion to put the bylaws forward. However, maybe that's preliminary based on some comments that were made that members of the bylaws committee have not yet met to finalize this. I don't know, Jeff, if you want to say,
It
or?
was my understanding from the last meeting that the bylaws committee was to meet. We were to hash out the changes, work it out, make sure it was done. Bylaws committee has not even attempted to meet,
Okay.
and we have no idea, other than what she sent out in an email on Friday, I believe, or maybe a day before that, anything else. So am I wrong? Do other members please comment? Scott?
I concur.
Okay, then what I would like to suggest is we do pass them out to everybody tonight, that no action be taken, that we leave it to the bylaws committee to meet between now and the next meeting. And the bylaws committee can do a couple things. One, they can come back and say, what we passed out to everybody is indeed what we had wanted it to be. And then this body can make a motion to take the first of 2 votes on it, or someone can make an amendment to it. Or the bylaws committee may come back and say, well, we took a look at the work that the chair of the committee had done, but it's not exactly what we all wanted. We all thought it was supposed to be, and bring us back another draft. Does anyone think there's any fault in that as an approach? All right, so we'll pass it out tonight, and Tim, I'm going to just start it with you and pass it around, and let everyone just.
These that were.
Oh, these must just be extra copies.
Somebody bring
Okay.
extras?
And then, so, we'll leave it to the bylaws committee to meet. I think that Anne Marie, the chair, will probably reach out to the chair of the bylaws committee and say, you need to do that. Because it wasn't our intent to not have the bylaws committee endorse this. This is just what the chair of the bylaws committee put forward. All right, the second issue that I'm gonna cover before I gotta go is, we had a meeting with the Iroquois Hospital Alliance last week to talk about the drug shortage. It was attended by a couple of the docs. It was attended by myself. It was attended by Tim, Anne Marie. Also, several agency representatives came. Steve came, Ryan Wood came, Kevin Robert came, Dean Romano came. We all described the challenge that we're having. Iroquois Healthcare Alliance is the trade group that represents hospitals. We knew it was good to go to see them because they have a drug shortage too. But they also have a huge amount of buying power. Their drug shortage is different. So for example, in some of the drugs that they need, they're getting, because there's a shortage, the supplier is only giving them 80% of their regular allocation. But that is, you know, that's pallets of things when we're looking for individual, very small quantities. They're in the group purchasing business, which means that they, for the hospitals, they aggregate the hospital's buying power and then sell to the hospitals at a lower price. We actually did a GPO, for those of you who've been on the council for a while, with them 5 years ago through Iroquois. It really didn't fly because we didn't buy from it, but it wasn't for drugs. It was for bandages and ice packs and you know, regular gloves, regular commodities. Coming out of the meeting, there were a couple, I think it was a very encouraging meeting. We made the case that for the hospitals in these 6 counties, we are not able to do the optimal job of getting patients to your emergency room treated the best way we can if we don't have the supplies we need, and the hospital should be willing to help us. I think in principle they agreed. I don't think we know how they're gonna help us, but so this is the steps we're gonna take. First, the FDA is beginning to publish guidance on products that can be used after their expiration dates. Since there's shortages of drugs, the FDA is actually looking at certain drugs and saying, well, those can be kept for 6 months more. That's not a real solution to a problem because some of these shortages are years long. So that doesn't necessarily change anything. And some drugs, that's not the case, right? We know Epi, on the end of the day, when Epi's done, Epi's done. But they're going to get us information. They're going to look for information on that and see if it helps us in any way short term. Secondly, we're going to share with them the hospital restocking agreement, and they're going to talk to the hospitals about whether the hospitals have an interest in somehow working with us on this. So basically the 9 hospitals in our region, we're having a hard time from the bottom up getting their attention on this. They're going to try from the top down. Dr. Daly is working to do some I think Mike had to step out, but Dr. Daly is doing some research on what drugs we use and how much of them we use in total, and I think he's trying to do that through the state database. And I'm going to be putting out a survey to all our agencies, asking the agency heads to tell us what drugs are you currently in need of and unable to get, and how much, and what drugs that you have that are going to be expiring in the next 6 months that you know that you won't be able to get to replace. And see if we can get a list of what the drugs are and how much. Of some of the providers that were at the meeting talked about it from their own perspective, where they're a small provider. I only need 6 or 8 or 10 of these, and I may not even use all of them, but I can't even replace the 6 or 10 I have in my drug boxes right now. And when they expire, I'm going to have 0. And some of the providers, it's bigger. So we're going to do a survey. Mike's going to try and get some data. We're going to keep the meeting going with them. They're looking at they had said, are you guys interested in getting back into the group purchasing with us? And I was very honest with them and said, it didn't work the first time. I don't know if you shouldn't put a lot of effort into helping us build the group purchasing organization if no one really wants to buy from it. So let's be, but if you guys can help us get these drugs, if you can figure out a legal way, and we talked about there's some legal minefields in this thing. If we can figure out a legal way for the hospitals to give those drugs or sell those drugs to the local EMS agencies. So, you know, if the hospital's allocation is 500 vials and we need 12, can they get us the 12? Can Columbia Memorial do it with Greene County? Can Albany Medical Center do it with Mohawk or whoever? There's a lot of work to do on this, but we've got the conversation started. The next piece is on us to get them data. I'd ask anybody who was at the meeting if I missed anything to please add into it.
I think you covered everything.
So, all right. The last thing I want to do probably belong more at the items on the floor, but I just want to mention that Brian Wood's not here tonight, but Albany County, but Scott is past Albany County Sheriff Campbell passed away this week. Today was the wake, and I think the memorial service is tomorrow. I thought, at least for those of us that are from Albany County, we should acknowledge that Sheriff Campbell was the man, or one of the men behind the beginning of the Albany County Paramedic Program, which is, become quite an important ALS program in our region, and just, acknowledge his passing.
Did you want to do any reporting?
The New York State EMS Council hasn't met since the last time we met, and we'll meet in May, so no report until then. And we still do not have a director of the Bureau of EMS, nor do we have a deputy director of the Bureau of EMS, and Andy is still acting director of the Bureau of EMS. But a lot of people are speculating. Thank you.
Thank you, Steve. All right, operational reports. Dr. Daly stepped out, but I don't know if he's left completely. Dr. McHugh, REMAC Academic.
We have a meeting until next month.
I'm sorry, can you say that
We
again?
have a meeting until next week.
Treasurer report, PJ?
Yes, you have the treasurer's report in front of you. You can see there's a little bit of change this month. I asked Dave to come up with a comparison so that we have a year-to-date comparison.
Thanks, Steve.
Compared to last year at the end of February. A couple of notations down there that you may want to see. I'll do the summary first. Basically, cost of doing business is up $69,000 compared to a year ago. About 30 of that is in salaries alone. Our revenue is down about $38,000, and our accounts receivable up about $32,000. So you'll see in our cash is down significantly. However, it could be a matter of just timing as well, due to some of the receivables that are out there. And I noted in Tim's report that we just vouchered the state, so stay tuned. But that's one of the reasons when we did our budget this year, I wanted you to understand that we appropriated some fund balance towards our operating budget this year because of the increased costs. So what you're seeing now is probably some of the beginnings of that. We're still in very good financial condition, but be advised we do need cash to operate.
Seal and Jim, no action. Under information sharing, DOH disciplinary actions, there were none. Course applications, excuse me, there were none. Correspondence, none. And under committee reports, Steve just gave his. PJ, MCI?
No report other than our committee. Amy Manchester has agreed to come on our committee. So it'll be myself, Les Freemantle, Kenny Martin, and Amy.
Membership, Maria, were you gonna report for?
I have,
Oh, I'm sorry.
sorry.
Go ahead.
No, I was just gonna say I have Lynn's thing with, oh, she sent it to you too?
Yep, go ahead.
Oh. Interesting. So, I'm not sure if it's the proper time to make motions or not, but this is what she says. Report for tonight. Have received 2 letters requesting reappointment from 2 council members this evening, Anne Marie Cross and Carol Brandt. Both are members in good standing. She's, can I make a motion on her behalf? I'll just make the motion in mine then. How about that? I make a motion to reappoint Anne Marie Cross with a term from March of 2018 to February. Right? 4 years, right?
Or I think maybe she meant to say 22.
Yeah, 2022. She has her math's poor.
I'll second.
All in favor?
Aye.
Opposed?
And then I'll make another motion to reappoint Carol Brandt with a term from March of 2018 to February of 2022.
A second.
All in favor?
Aye.
All opposed?
motions and both are seconded?
No,
Yeah. I'm sorry.
we
Second.
cruised through the first one, you missed the vote on the first
Okay,
one.
didn't hear it.
Yeah.
Yes. Second.
And I believe that concludes Lynn's report. Unless Maria, am I missing anything?
Not that I'm aware of.
All right.
Nope, it's the same
It would
report I
be-
got.
It would be difficult to say.
Nominating. Maria?
No
Anything
report
else?
tonight, I'm still learning the job.
Awards? And Brian's not here. Does anyone reporting for Brian?
Please send them in. Let's make winning an achievement, not a no one better type award. I'm not sure exactly what that means, but that's what Brian typed to me as we were sitting there. So I'll say that Brian had to deal with a structure fire in a cat hoarder's house. So apparently 6 inches of cat poop is a big deal, and he didn't think that coming here and bringing that with him was, yeah. He thought you'd be appreciative, so I'll be reporting on his behalf. Did you get all that?
Highlighted.
Minutes. I just tune you all out.
Next report, we've changed the bariatrics committee report to patient safety handling, unless someone has a better term for it, rather than bariatrics, because it is for all patients, patient safety. Brian?
So Brian had sent out an email tasking a bunch of people with getting some information, a person from each county as well as a few other people. So he's asking whoever was on that email, please get him back that information as soon as possible. And that looks like about it.
Yeah, Brian actually had asked me if he could meet with us at the nurse committee group, and so the next time.
That's we're pending a decision on talking to the nurses committee about cost and their ability to participate.
I mean, I spoke with him, he's kind of hoping that he'd have a lot more responses by our next meeting that could bring forward.
Yeah, and we're really trying to get more responses from the hospitals. Saratoga's very supportive, and we're, I think Angelo is extremely, agreeable to do whatever we need to do on our end, and I've had, preliminary conversations, but I think, the other hospitals, we certainly need to get everybody on board from, I think Albany Med is probably close to doing that as well, so we need to get all of St. Peter's Healthcare and everybody else in order to be able to do a one-for-one exchange with everybody, which is, we're not quite sure that everybody else is there yet. Ellis is also, I think, they want to do it. I don't think they've brought it up yet to the level, and we haven't really had that discussion about, bringing it to our CEOs officially. So that's, we certainly can do that as the one-for-one. Brian and I had a discussion about, the purchasing either, the hover mat, the mats themselves versus the canister. And I think if we did it as a group and certainly went to the company, we'd probably get something, whether they give us mats or whether, each one person, or each, company, purchases like a canister or something. I know all the ERs have canisters. I know all the ones anyways who participate in the nurses committee. So, we're set on that end, and I think just getting that maybe for EMS was one of the things that we had thought, but then it's really came down to where, if everybody would fund it and participate. And I know there was discussion about, the nursing home, using it for the nursing homes, and would they also be able to financially be able to support that? So that's the, kind of a lot of discussion. Now, Lester, he discuss anything? No?
Not yet.
Okay. Carol, is there anything else you could remember with that we talked about with the hover mats and everything?
I think it's just, we need to get more information.
Right, and get some pricing, I think. So Amanda Berenger, who had some prices, I tried reaching out to her too, and she did respond that she wasn't gonna be able to make the meeting, or I didn't know about the last meeting, but this time before I wasn't able to reach her, so I'm not sure where she's at with the, with the pricing, but that's really what we need to try to get some, so maybe between Brian and, the nurse committee will be able to do that. Is there anything else with that? Okay. Okay, Any questions about any of the reports? Okay, county reports. Anyone else reporting for Albany County in Brian's absence?
No.
Okay. Columbia, TJ?
Columbia will be having an active shooter drill, I see, on the same day as the Greene County EMS Council Teaching Day. So it is May 19th, and it'll be at the Germantown Central School. Multiple agencies will be involved.
Thank you. Any report from Greene County?
Greene County has set May 26th at the Wyndham Country Club for its EMS Recognition Night.
Kevin Robert is excused. Amy, Rensselaer County?
I have nothing, but just happy Easter to everyone.
Very nice. Thank you. Same to you. Schenectady County?
No report.
No? Okay. All right. Is there any new business?
Ken?
Ken, as in years in the past, I'm doing the bike ride again this year, and I put a letter in just looking to see if the board would be willing to approve a donation again. So,
We did that last year.
yes.
We've done that probably the last 4 or 5 years.
Last 4 years, I think.
How much was that?
That I don't remember. Remember?
What's it been, like 250?
It's been between 250 and 5. I can check the exact.
How about-
You don't even remember?
How
What we
about,
sent
I
you?
don't remember.
how about it
I
doesn't
can-
matter? How about, I'll make a motion that we do exactly the same amount that we did last year.
I'll second that.
Bingo.
All in favor?
Aye.
Opposed? Excellent. Is there any items from the floor?
Everybody here should also pony up some money and support Ken. It's a very worthwhile cause.
Yeah.
I mean, your agencies, I know we're all broke, but your agencies.
I got a question.
By the time I get back to purchasing, it'll be his 3rd year running.
Well, start now.
People have bought a new bike. Tim, do you know, is it possible if we were to, I guess, be innovative and ask the EMS community a couple of broad-based questions? One being, if there was a thing that you could change as a provider about the system that affects you personally, or would make it better for you to work, better for you to continue to participate in the system. Again, and I'm kind of, I don't have the perfect wording for it, but it would affect them personally as a provider. And then the second question would be, do you have any suggestions to improve the system? Again, not diminishing the, insight and innovation of the folks sitting in the room, but sometimes very simple things may come forward, and we around this room would go, gee, I never even thought of that. That's a pretty simple fix, and if that will make life easier for a provider or somehow improve the system, I just don't know if there's a mechanism out there where we could do that.
Well, we could do it via SurveyMonkey or something else, but I have to preface that with saying I do not have an individual provider database here. I have an agency database. I can forward it to the agencies. One way we may be able to do that is through Remo Online with Robbie McHugh. I would have to double check with him if you indeed want input from individual providers.
Yeah.
So I could look into that with Robbie and see if we can do that through Remo Online. If he can't, then I'd have to think another way to get that message out there to our individual providers, as opposed to some type of, agency solicitation. So
Yeah.
I can
Well,
look into it.
It may be simple enough, I mean, if you guys like the idea, to simply put up a method to get the information back to us, whether it be anonymously or if they want to, include their name. And really just a poster up in all the agencies.
I mean, we could
thinking-
probably do something through Facebook, do something through the website too, but, if you're looking for that specific target audience, I'd like to reach as many as possible, so I'd have to research the best way to do it, I think.
Yeah, just food for thought.
Okay.
Just on the same basis there, the State EMS Council put a white paper together that says the changing faces of our
challenges facing emergency medical services in New York State. That was drafted and sent out to the Assembly, the Senate, and the Governor's Office. Maybe a good idea to have Steve Kroll distribute that throughout the regional council to get a good look as far as exactly his work and other agencies' work on this paper that was actually sent out.
Do you have an electronic copy of that?
Steve does.
Okay. And Jim, can you send me an email to that effect tomorrow, and I'll work on that?
I'm one of the people who actually sent this out along with Steve, being head of one of the state associations. It's one of those things that's actually a very good article to see exactly where it's happening now in EMS, and basically put the state of New York on notice that EMS right now is facing some challenging times. It's shocking.
Shocking.
Yeah. Good job. Good luck.
Any other items from the floor? Have a motion to adjourn?
Motion.
So moved.
Second?
Second.
Okay. Adjourn. Next meeting is April 23rd, and I will be in Florida, so Steve is going to